We are going to study about landmarks which are seen in maxilla and mandible. The landmarks which are seen in maxilla and mandible, they appear of two types, radiolucent and radioopaque. Radiolucent L comes in black, so radiolucent appears black or dark in radiograph, while radioopaque appears white or light in the radiograph. As we can see, this is a structure of a tooth in which this is appearing the most white, grayish, black. So the most white substance is the enamel. The one thing we should remember is the radio opacity. What? Radio opacity. Radio opacity depends on the mineralization. Mineralization is more, the white color will be more. So in this case, the enamel is the most mineralized substance, therefore it appears white, which is 90% mineralized. The dentin is less mineralized than enamel, which is 75%, therefore it appears less white or less radio-opaque, while cementum is the least mineralized, therefore it also appears radio-opaque. But the pulp is not mineralized, it is not mineralized or calcified, therefore in the structure of tooth it appears radiolucent. It appears radiolucent. And the pedial space is also not mineralized. It contains the pedial ligaments. What it contains? Periodontal ligaments, which is a ligament or fiber. So fibers are not mineralized, therefore it appears radiolucent. So we got the basic idea of mineralization and what we can see in the structure of tooth. Enamel, dentin, cementum, pulp. Enamel, dentin and cementum appears radio-opaque. Pulp as well as pedial space appears radiolucent. To start with the maxilla. These are the landmarks which we are going to see in maxilla. The radiolucent landmarks seen in the incisor region are incisive foramen, nasal cavity fossa, lateral fossa, which is also known as incisive fossa, mid-palatal suture, superior foramina of nasopalatine canal. While the radioopaque structures which are seen in incisor are nasal septum, floor of nasal cavity, anterior nasal spine, inferior nasal concave, and soft tissue of nose. In the canine region, in maxilla, we can see radiolucent structures such as nasolacrimal duct, nasal cavity, maxillary sinus, and lateral fossa, while the radioopaque structures which are seen in canine are inverted Y-shaped line or line of Ennis, lateral wall of nasal fossa, anterior border of maxillary sinus, floor of maxillary sinus. In the premolar region, we can see radiolucent structures such as nutrient canals within maxillary sinus and maxillary sinus. The radioopaque structures seen in the premolar are septa within maxillary sinus, borders of maxillary sinus. While in the molar region, in the maxilla, the radiolucent structures we can see are maxillary sinus, nutrient canal within maxillary sinus. The radioopaque structures seen in molar region are septa with maxillary sinus, borders of maxillary sinus, maxillary tuberosity, hemular process, zygomatic process of maxilla, zygoma, coronoid process of mandible, and pterygoid plates and hemulus. To start off the supporting structures, there are two structures we have to study. One is supporting structures and one are the landmarks. The supporting structures are common for both maxilla and mandible. There are four supporting structures. Lamina dura. Lamina dura is nothing but lining of alveolar bone proper. We know the alveolar bone in which the tooth lies. This is our alveolar bone. This is my tooth and this is my alveolar bone. It appears radio-opaque. How it appears? It appears radio-opaque means it appears white. It appears white just outside pedial space. So in this diagram, as we can see, this is our tooth. This is our tooth. The red line is our pedial space, and outside it we can see lamina dura. This blue structure, as we can see, it is lamina dura. It is wide and dense, heavy occlusion teeth में it appears wide and dense, and in the teeth which have less occlusion or less function, it appears thin and less dense. So one thing we have to remember about lamina dura, that it appears wide and dense in the case of heavy occlusion teeth, while it appears thin and less dense in the case of less occlusion or less function. Here we can see the continuation of lamina dura. This white structure, ठीक है, this continuation of alveolar bone proper is the lamina dura. अब lamina dura का loss कब कब देखने मिलता है? When we can see the generalized loss of lamina dura. In 3 cases we can see the loss of lamina dura in hyperparathyroidism. As we know parathyroidism, so first we have to break the words. Parathyroid is a gland, parathyroidism is the disease, hyper means more. So parathyroid hormone is releasing more hormone, PTH hormone, parathyroid hormone, it is releasing more. So in that case, due to increased parathyroid hormone, there is increased calcium level in the blood, and this calcium in blood comes from bone and teeth. Breakdown of calcium from bone and teeth, breakdown of calcium from bone and teeth to increase calcium level in blood. Therefore, there is loss of lamina dura in the case of hyperparathyroidism. Also, we can see loss of lamina dura in Paget's disease and hypophosphatism, where there is less phosphate. In that case also, we can see loss of lamina dura. The next structure is pedial space. Pedial space is nothing but tooth root. It is the space between the root of the tooth and lamina dura. It is known as pedial space. It appears hourglass. How it appears? It appears hourglass shape, thin in middle of root. It is thin in middle of root and thick at the ends. So it appears like a hourglass shape. ठीक है. Thickness is directly proportional to occlusion or function. That is, where there is more occlusion or function, the thickness of pedial will be more. Where there is less occlusion or less function, the thickness will be less of pedial. In which cases we can see absence of pedial space. Absence of pedial space is seen in hypercementosis, Paget's disease, Ankylosis. Hypercementosis is nothing but there is increase in the cementum in the case of Paget's disease, and in the case of ankylosis. Ankylosis is nothing but the fusion of tooth root and the alveolar bone proper. There is no pedial in between. And we can see the fusion. This is the root. This is the alveolar bone part. The space should have pedial. This was supposed to be normal, but in the case of ankylosis there is fusion of the root as well as fusion of the bone. This is alveolar bone and this is tooth root. There we can see fusion. This is known as ankylosis. Where we can see widening of pedial space, means increase in pedial space. There are 2 reasons due to which pedial space increases: due to localized infections or localized reasons or generalized reasons. Localized reasons include periapical lesions. Periapical is nothing but the root. This is known as apex. The lesion related to the apex is known as peri. Peri means surrounding, and apical means apex or tip. Lesions are nothing but abnormalities. So periapical lesions. And the generalized reason of widening of pedial space includes osteosarcoma, scleroderma, trauma from occlusion. Osteosarcoma. Sarcoma is nothing but cancer or neoplasia related to bone. Scleroderma related to skin, and trauma from occlusion. Any trauma caused from occlusion. In that cases we can see widening of pedial space. The third structure is alveolar crest. Alveolar crest is nothing but this, the space between two teeth and the cervical portion of alveolar bone, and the cervical portion of alveolar bone is known as alveolar crest. As we can see in this structure, this is known as alveolar crest. This is known as alveolar crest. This is known as alveolar crest. Gingival margin of alveolar bone or cervical margin of alveolar bone that extends between teeth, is known as alveolar crest. How it appears? It appears radiopaque. Loss, where when we can say that alveolar crest is lost when there is more than 1.5 mm from CJ. लॉस हम लोग कब बोल सकते हैं? व्हेन वी कैन से लॉस, दिस इज माय इनामल एंड दिस इज माय सीमेंटम एंड दिस इज माय सीमेंटो इनामल junction. So here lies my alveolar crest. If the alveolar crest gets down by 1.5 mm towards cementum, then we can say that alveolar crest is lost. Okay, lose या loss more than 1.5 mm from CJ, more than 1.5 mm from CJ. Okay, so this was about the alveolar crest. The fourth supporting structure is cancellous bone. The other name for cancellous bone is trabecular bone, spongiosa. Trabecular bone, spongiosa and cancellous bone, all three are the same structures. What is the meaning of trabeculae? Thin radio-opaque plates and rods. As we can see in this structure, thin plates and rods. Thin plates and rods. Okay. Thin plates and rods, many small radiolucent pockets. As we can see, many black pockets. Trabeculae appears radiopaque, means it appears white, while the pockets appear radiolucent, means it appears black, which is nothing but marrow. Marrow is nothing but, we know about bone marrow, so that marrow we can see which appears radiolucent. So to summarize, the supporting structures seen in radiograph are lamina dura, pedial space, alveolar crest and cancellous bone. Lamina dura appears radio-opaque or white, while pedial space appears black or radiolucent. Alveolar crest appears radio-opaque or white, and cancellous bone, the trabeculae, appears radio-opaque, means white, while the pockets appears radiolucent, means black. So this was the summary of supporting structures of radiograph. In the next part, we are going to study the landmarks of maxillary radiograph.